Is there a patient that you'll never forget?
I have several patients that, pop into mind.
Yeah.
Yes, I have.
Yeah, there's probably a few. Let me think about this one.
A patient that I would never forget. Okay, actually I have one.
One was somebody who had 4 earlier pregnancy losses, and she came in with a set of twins, and unfortunately they weren't far enough along that they could live on their own outside of the womb.
Many, many years ago, when our technology wasn't near as good as it is now, I had a patient that had a placenta increta, which is where the placenta invades too far into the uterine wall, and we didn't see it. And she died. They didn't know about it ahead of time. We were in a small rural hospital. She delivered the baby and she died. And I will never forget seeing the dad looking through the nursery window at the baby and no mom.
I was early in my career, and I had been called to the labor and delivery floor to scan a patient who they couldn't find the heartbeat. And they wanted to know why. Oh my gosh.
As I started to scan her, I realized quite quickly that she had a terminal condition that she didn't know about. And that bothered me afterwards because I was thinking she doesn't realize that when her doctor calls her, her life is going to change. She's probably not going on that vacation. She's not going to see her grandchildren. So that really bothered me. Yeah.
You're scanning a 40-something-year-old man who comes in with like a little discomfort in his right upper quadrant, and he thinks he's got gallstones. And you put that transducer down, and then you see that he has a pancreatic mass.
You have to have this poker face that nothing is going on.
Many times we know what's going on, and we can't disclose that to the patient because we don't diagnose. And we have to keep a straight face about it, even if it breaks our heart, because sometimes you don't even know the patient, but you see what's going on.
Why do you keep going back when something like that happens? It's because you still love people, and even though it's difficult, you know that you'll see good cases and you can be there and support them.
I had a patient come in. She was not feeling well. She had already been to the ER. They had dismissed her. She went to her primary care physician. They had dismissed her. I started out and her heart looked good, but the aorta was slightly dilated. So I went up a little further, took some extra images that we don't normally do on all echocardiograms. And there I saw a dissection that was actually extending into her carotid artery. If it's not caught, it's fatal within 48 hours. She came back, I guess, about 6 months later, and she hugged my neck and said, "You saved my life, this is so wonderful." If she had not come to see me in the first place, and this ultrasound had not been done, if the echocardiogram had not been done, she would not be here.
I was working at a diagnostic center at the time. They said, "Joy, can you take this patient in because this gentleman will not have any services at the hospital, and we're really concerned about him. He's having a lot of pain." And he had the largest aortic aneurysm I've ever seen in my life. I mean, it was almost 8 centimeters in diameter, and 3 is considered an aneurysm. So it was just ticking. The guy said, "I just got my El Camino. I just got the leather piece that goes over the back. I just got it done, and there's no way in hell I'm gonna leave my car at the hospital for somebody to mess it up. I am going to follow you to your house, and I'm gonna wait for you to get your bag, and I am going to take yourself to the hospital." And he came back about 2 months later, and he didn't say a word. And as soon as he turned the corner, I burst into tears. And in his typical wise guy style, he had a gift certificate to Macy's and just handed it to me, not signed, and said, "Thank you."
When I worked in Baltimore, there was a woman who was traveling from California and got sick while she was on the East Coast. She didn't have any family with her. And I said, "I promise you, we are gonna get this figured out. We're gonna get you back to your family, and you're gonna be just fine." She and I actually still send Christmas cards to each other.
We had a patient come in when she was 32 and pregnant. She had felt a breast lump, and her GYN
said, you can go, you can have it checked out, or you can wait on it and see what happens. We'll look at it again in a month or whatever. And she came in to see us, and it was a breast cancer, and it was a very aggressive breast cancer. We were able to get her surgery, get her treatment started. It's been probably 10 years now. She's alive and well. Her son is alive and well, and she's out spreading the word that people need to come in. They need to have their lives saved.
We really do make a difference in people's lives. We save lives, and we help people through difficult times.
The patients, the need for us to do what we do, the physicians thanking us for what we do, our patients thanking us for what we do, that's what really keeps us going.